mental health interventions are still behavioral interventions like a substance use disorder intervention. Before we get into it, I want to stress the point that the majority of people who call in tell us that it is a mental health disorder problem. It is rarely that. It is almost always a substance use disorder that is driving the mental illness, even if it's just marijuana. When it is just a mental health disorder, what's astonishing is that the behaviors of both the mental disorder and the substance use disorder are identical. In the manual that we use when we come to your home, we were going to change that when mental health diagnoses spiked during COVID. And the feedback that I got from my professionals is that we didn't have to, because when they presented the book to true mental disorder only, no history of substance disorder patients' families, they were astonished at the book and the behaviors associated with the person. A substance use disorder is a mental health disorder, and it is all behavioral. Everybody is acting out something. There's an inability to cope. Depression is the inability to construct a future. Bipolar disorder is the disorder everybody gets when they can't figure out what disorder it really is. It's the most diagnosed, overdiagnosed, and misprescribed disorder that we have. And everybody that calls us, and I say everybody because it isn't absolute, tells us that there's some element of substance use disorder, but I have to make something clear. As clinicians, we are taught something that everybody has seemed to have forgotten. And that is, whenever a disorder is present, a substance or a mental health disorder is present, and there is substance use involved on any level, even minimal, the clinician must always assume that the behaviors or impairments are a result of the substance use until proven otherwise. Interventions and interventionists do not intervene on the diagnosis. They intervene on the inability to advocate for your own care and your treatment resistance, whatever the disorder is. The facility will address the problem. The problem right now in a mental disorder intervention is the same: the family system and the patient's inability to accept help. So how you address a mental disorder intervention is extremely similar to a substance use disorder intervention. And rather than get hung up on what is the problem, we have to get hung up on why is the problem not being addressed. And we have to look for those points of behavior and comfort being provided. Because everybody thinks they have to want help, even when it's a mental disorder. And the question is, why aren't they doing it? What are they getting out of not addressing the problem? Are they seeking to hurt the family because of the way that they feel? Are they just not interested in doing anything with their life? Are they being enabled to a point where they're comforted so that they don't have to? We have to look at everything. It's not as simple as, hey, my loved one's got bipolar, come and get them the treatment. We have to look at why they're not going, and we have to focus on the behavior rather than the diagnosis. And in the article that this video is on, I reference how so many disorders are misdiagnosed or overdiagnosed because we immediately resort to the diagnosis so that we can, bill insurance, not we, but people can bill insurance and people can label people and they could become victims. What I want you to understand is that that is left for the assessment at the facility, and that is left for the professionals to get through, because no matter what the problem is, you have to bring the patient to a baseline. And once you bring them to a baseline, then you could start working with them. So many people are taking a treatment and they're on the wrong medications, they've been misdiagnosed, even before they started using substances. So with a mental health disorder intervention, you must have a professional that can guide your family through why they're not advocating for their own care, why are they treatment resistant, and are there any family members, behaviors, and or family roles that are comforting the problem in a way that disables the person from addressing their problem. Mental disorder interventions require a lot of collaboration, and it is not something that your family can handle by themselves.